More than 40% of veterans enrolled in VA's healthcare system live in rural areas of the country. We begin our show with a story of how VA is reaching out to chaplains in these areas to teach them how to connect with veterans and where to access support services.
This is Carrollton, Kentucky, halfway between Louisville and Cincinnati. Home to fewer than 4,000 residents, it is nonetheless one of the larger populations in this area, which explains why this conference facility in Carrollton recently hosted a VA-sponsored training session designed to help rural community clergymen and women better understand the unique needs of veterans and their families.
The goal is to get information about services for veterans further out into the rural communities. And that's what this training is about. Not only do we want them to have really good pastoral care skills that are adapted somewhat for veterans and the veterans' unique experiences, but also we want them to have a variety of ways to refer an individual into mental health care, physical health care provided by VA.
And our veterans need to reset. Referral is an extremely important part of this. We're trying to help veterans get the care that they need. And veterans don't always know about the services that are available to them. And clergy don't always know what the VAs are doing. So my role here has been to try to bring two groups of people together, the clergy and the VA, to help them talk to each other.
The clergy in attendance here came from rural districts of Ohio, Kentucky, and Indiana. About a third of them are veterans themselves.
As a pastor and a Vietnam veteran, I still was unaware of a lot of things that the VA could do in partnership, and that we could work together, provide a lot more resources to the veterans.
What we know is that pastors are often sort of the first line of defense. They're the people that veterans are really more likely to go to for help initially than they are to actually psychiatrists or psychologists or even social workers.
I know you've been through this before and you've deployed yourself before. And
the aha moment for this project was reading the research that says that people of all sorts, veterans included, are 5 times more likely to go to their pastors in times of crisis than they are to go to all other mental health care providers combined. So to me, it's vitally important that our pastors understand who's coming to them and what they're coming to them seeking.
And that's when he was in Germany.
okay.
So
Air Force veteran Cheryl Rogers isn't in crisis, but she is experiencing feelings of anxiety.
it's just comforting to know that you have someone to talk to, and no matter how personal it gets, that it's going to stay right there.
Back in Carrollton, these pastors now have a clearer idea of where to turn when it appears a veteran needs more than just pastoral care.
What we've tried to do is a very convenient way for civilian clergy to be able to call one person here at the hospital, and they have my direct office number, and they can call and tell me the need that they have with a veteran that they're working with.
VA is planning additional training sessions with rural clergy partners, with both sides dedicated to meeting the needs of veterans wherever they may be.
If you would like to learn more about accessing health benefits, please visit the web address you see on your screen.